The United Nations Human Rights Council has appointed health and women's rights activist Dr. Tlaleng Mofokeng as special rapporteur. She'll focus on the right to to quality physical and mental health. Let's speak more then about this with the doctor herself. She's joining us by Skype this afternoon. A very good afternoon to you, special rapporteur to the United Nations, Dr. Tlaleng Mofokeng. Has the weight of the responsibility sunk in?
It's sinking in very fast because we have to hit the road running. There's no time, to ease into things, especially in this time of this global pandemic. So, yes, I have to just get on with it.
And your passions, having followed your work, I know, are not limited to, but include quite strongly a commitment to getting proper access to healthcare for women in particular. You also are quite a strong advocate for the rights of sex workers. How are you going to advance those two causes going forward?
The main thing for me for the next couple of years is to really center the idea that vulnerability on its own is an independent human right. And if you look at all the negative health outcomes that affect the population sector that you've referred to, it's literally because people's dignity is not affirmed and protected. And if we can come up with policies, with laws, with services that can restore dignity, I think we will go a long way as countries, as member states, in ensuring that justice is seen for many people, but also importantly that we promote and protect the gains that we have made over the years and not really allow pushback or conservatism or extremism to shift the focus on human rights. I think for me, that's what the most important thing is for this role. It's to advise, look at emerging trends, but most importantly, ensure that we recenter those people who are vulnerable or who find themselves in vulnerable situations.
And how much power does this new job come with? Because you're very much a person who likes to be out on the ground and effect change. Does it allow you that sort of immediate effect in terms of results?
So it is very much about independence. I'm not an employee of the UN, but I am seen as an expert advisor to the UN. And part of the work is doing country visits in instances where there may be allegations of human rights violations in different member states. And I think that's where being grounded in communities is important, is when, you do these country visits for investigation or for research, to meet and speak to people on the ground, because they are the ones who are at the brunt daily of some of these system or governance or leadership failures around the world. And so I think the work is taking on a different theme and expression, and it's important to talk about the longevity that's required. We like you say, I've done a lot of work in the region, especially in the country, and it is sort of that next step where the work is still around access, it's still around services that are comprehensive and accessible, but it's just that we are approaching it now from a different space, and it does require longevity because the term is 3 years but can be renewable for another 3 years. So that's 6 years to really carve out and have that impact on the global space.
And before global, you are African, the first African black woman to hold this position. When you look at the way African governments have been dealing with issues such as women's access to reproductive health care, issues again of sex workers' rights and how they are sometimes abused by systems that are meant to protect them and denied health care, do you think that the governments in Africa understand or get a sense of the urgency with which we sort of need to move ahead on these issues?
And what you are speaking about, or your question speaks to the accountability, right? Is that a lot of the times, and this is true for other areas of the world or other regions in the world, is that where there is no accountability, where civil society is unable to advocate and organize to hold their own government accountable, that's where you find that a lot of tension happens and a lot of injustices happen, and most of the times untold And I think that's why the role of the special rapporteur is important, because we can get those stories out. We can get those lived experiences to be documented to actually then have impact. Because what you will find is that often in the different countries, there are reasons why certain people or population groups are not listened to. And it's about elevating those voices. It's about giving the required importance to the issues. And of course, where people need to be reminded of to do the right things, that's what we will do. But I don't think people do the wrong things because they don't know about human rights. It's this idea that they can get away with it and that the people in countries will not be able to have any form of recourse.
And one immediate example that jumps out to me, Doctor, here in South Africa is about the Qwaqwa water crisis. You're from that area. You've spoken about it several times. The big headline is about a lack of water, proper, clean running water for the people. But when you've got a situation such as that with water, somewhere down the line, it becomes a health issue, doesn't it?
It definitely does. And even the United Nations recognizes how different other human rights, such as access to water, access to electricity, sanitation, vaccination, nutritious food, all of those human rights can determine whether health outcomes are positive or negative. If you look at the water crisis in Qwaqwa, it existed way before COVID. But when the health messaging around COVID says people must wash their hands for 20 seconds frequently, the question is, with what must they wash their hands? And that's where the injustice is that a lot of poor communities cannot outsource these basic services to private service providers. Water can't be an issue that's allowed, to be only accessible to those who can afford to buy filters or to go and make other means. They should be freely available. They should be clean, sustainable supply of water. But it shows you how a global pandemic such as COVID will further marginalize, will further fracture the very fragile public health system, especially district health. And so as much as COVID is making those things worse, a lot of us know that the problems have existed even before COVID. And how we respond to that comes to my previous point of restoration of dignity. If we are committed to restoring dignity, we will not let a lot of these injustices go by.
And just final question on that thought, Dr. Tlaleng. COVID-19 and the messaging around water and Qwaqwa, what you were saying just now, we're also, I would imagine, going to have to be very careful in how we scrutinize government messaging, not just in South Africa, but elsewhere where COVID-19 is likely down the line to be used as an excuse for a lack of delivery in healthcare at some point, I'd imagine.
Yeah, and we do need to ask really serious questions around procurement, right? If our medical supplies and equipment and consumables are all imported, what does that mean for our own internal capacity when we've seen with COVID, freight and cargo in terms of transportation has been severely impacted? In terms of manufacturing and production, a lot of it still happens outside of the country. So what does it mean when other countries are prioritizing their own citizens in terms of medicines and consumables, and we're still depending on exports? So it speaks to the entire chain of service and how, when we're talking about equity, we need to think about the entire system, not just when a patient gets to a clinic, but everything else that needs to happen and be in order for them to be able to access clinics. So the issues of safe communities that are free of violence, lighting and good roads that people can access, healthcare services beyond just policy and the laws, because that's one area. But despite what the policy and law say, there's so many other determinants of good health that we are not really paying attention to, as if they are removed. And if you make the example of Qwaqwa, we're talking about the academic school year now. The children in Qwaqwa haven't been to school because there were the shutdowns all the way up until March. So when we're talking about rescue in the school year, what does it look like for those communities who, in fact, their school year was disrupted for weeks before COVID even hit? And so how we come up with those solutions, are important because, like we know, a lot of children depend on schools' feeding scheme. A lot of them depend on schools to be accessing water and flushing toilets. So it is really the system that's all of it is connected.